Hello everyone. Am I audible and visible? Welcome to discussion of report on medico-legal examination of accused of sexual violence. So in last week we discussed about medico-legal examination of victim of rape. So this week we are discussing about accused of sexual violence. Accused of sexual violence. If you ask me what is the BNSS related to examination of accused of sexual violence, your answer should be 52 BNSS. What is BNSS? As you know, BNSS is going to replace your CRPC. 53A CRPC, previously it is related to, that is examination of accused of rape. Now the new MCQ that can be asked, that is 52 BNSS, Bharatiya Nagarika Suraksha Sanhita. Okay. Accused of rape. Talking about accused of rape. It comes under 52 BNSS. Bharatiya Nagarika Suraksha Samhita. You can see here BNSS. What it states: examination of person accused of rape. Accused by medical practitioner. Remember, accused can be male, can be female. Okay. Female also can be accused under the act known as POCSO Act. What is POCSO? Protection of Children from Sexual Offences. Under this act, female can be accused, but most of the time in 376, it is only the male is the accused. Yes. So this is a practical exercise. We are discussing only the practical aspects of medico-legal examination. Okay, like example, how to write the certificate. That is what we're going to discuss in today's lecture. Theoretical aspects, the legal aspects related to all this IPC, PNS, PNSS, and all, you can go through the theory class. So this is purely a practical exercise. I'm discussing on practical things. How to write the certificate in next 25 to 30 minutes. Uh, what are the components of certificates? That is given by CBME curriculum, NMC, and the checklist. Checklist. The first thing you need to write general particulars. Okay? General particulars. As you know, X, address, alleged history. All this comes under general particulars. We're discussing again in detail about it. Consent. A very important component which carry 1 mark. That is the consent. Then identification mark. At least 2 identification mark required to identify accused in case of sexual violence. Relevant medical surgical history, half mark. History related to sexual violence, half. General of examination, zero point 0.5 mark. Examination of injuries on body, 0.5 mark. Local examination, 1 mark. Sample collection for clinical laboratory, 1 mark. Collection, preservation of sample for FSL, 1 mark. And hospital and FSL report, the collection of reports, that is half mark. And finally, the very important is the final opinion, that is According to CBME, it is a 2 mark. Finally, the signature name designation doctors that carry zero point 0.5 mark. So this is the you know the checklist related to the medical legal report that is accused of rape. Let's discuss one by one what you need to write. General particulars. The first thing, general particulars. Right. You need to write general particulars like name of the hospital. What is the name of the hospital? You can write MAMC or LNGP hospital, OPD number, IP number, OPD outpatient department number, IP number, inpatient number, name, address, age. So here can be the question can be asked. What do you mean by juvenile? So juvenile means less than 18. Okay. Male or female less than 18 year known as juvenile. Again, the question can be asked, what do you mean by heinous crime? What do you mean by petty crime? All this can be asked in your exam as per Juvenile Justice Act. Then the sex, male or female. Most of the time it is male. But remember, female also can be an offender as per POCSO Act. What is POCSO? Can be asked. What is POCSO? Protection of children from sexual offences. Again, there are various offences like penetrative, aggravated penetrative sexual assault, ASA, all the sexual harassment. All this comes under POCSO. POCSO can be asked in your exam in detail about POCSO and the punishment. Then date and time of arrival to the hospital, brought by police or court order or self. That you need to mention details of all this. Date and time of commencement of examination, brought by MLC number. It's a medical legal case. There will be an MLC number for each. Police station, like New Delhi police station, ITO police station, Tumagur rural police station, like that. Whether conscious, oriented to time, place, and person. Okay. Here, this is very important. Conscious, the word conscious, as we discussed many times in our class, consent matters a lot. That is, consciousness matters a lot while taking consent. So, you need to check for the conscious. So, you need to take the proper consent from only from the conscious person, oriented person. Conscious, oriented to time, place, and person. Yes or no? That you can mention. Any physical, intellectual, psychosocial disability, any personality disorder, if that is there, that you can mention. So all these are about the general particulars. Okay. So again, I'll repeat: the examination of accused of rape or sexual violence comes under 52 BNSS. Previously under CRPC, 53A CRPC. Can remember 53A, A for accused of rape. So the question can be asked, what do you mean by 52 CRPC, CRPC? All this can be asked. Next, accused person. We're talking about accused. Next, informed consent. So consent you need to take while during examination. That you can write like this. I, the name of the person. X, maybe X, the name of the person. Son, daughter of. Hereby give my consent for, that is, medical examination for treatment. Yes, there can be some requirement of treatment, there is injury. Medico-legal examination, that is nothing but your forensic examination. And the sample collection. So we are going to collect the samples from him and going to send it to the clinical laboratory or forensic science laboratory. So you need the consent from the accused. Right. What is the word should be mentioned? He also understand that as per law, hospital required to inform the police. Inform the police. Here, the Viva question can be asked. It comes under 13 CRPC. Also, it is mandatory under POCSO Act. So, this has been explained to me. I have been explained that if I refuse to consent for medical examination, it may be treated by the court as evidence against me. This word, all these words are very important. These words should be there in the okay against me. Then have also been explained as per law, that is 53, 53A, 54, depends on the condition. Reasonable force can be applied or can be used to compel me for undergoing this examination. This is what. So under the section 53A, the accused can be examined even without consent, even with a reasonable force. So this is what can be asked in your exam. 53A. But in victim examination, consent is must. Consent is mandatory. You cannot force the victim for medico-legal examination as per 160 CRPC discussed in last class. Okay. Yes. Now we are talking about the third component, identification mark. What are the identification mark like star, mole, and how to write the proper identification mark that we discussed in our this videos. Right, at least two identification. An example that is the mole. Okay. Next, then comes is the relevant medical surgical history. Surgical history that is relevant here, like any recent history of anal genital injuries or any surgeries or any diagnostic procedure, any medical treatment or any consumption of drug medicine that may affect the interpretation of physical finding. If anything, that we can mention in this fourth column, that is contraception, whether contraception used in the violence, yes or no. Say if it is there, then you can write yes, otherwise you can write no. Vaccination, vaccinated, not vaccinated, especially hepatitis B is a sexually transmitted disease, right? And tetanus toxoid vaccination status. If accused is a female arrested under POCSO sections, then you need to write all this. Menstrual history, all this detail, menstruation at the time of examination, menstruation at the time of incident, all this yes or no, LMP, all this can write in the relevant surgical medical history. So this is the fourth component. Fifth component, history related to sexual violence. How to write that? The first thing, date and time, location of the incident. What is the date and time the incident happened? That you can take history from the accused. Estimated duration between the sexual violence, accused perpetrator reaching the hospital, approximate time, number of episode, whether known to survivor. If yes, then what is the relationship? Here question can be asked, what is APSA? What is APSA under POCSO? Aggravated penetrative sexual assault. This can be asked when it is committed by someone who is a relative. Then description of incident in the words that you can write alleged history. Alleged history in the beginning you can write. So in the words of the narrator, accused, informant, that we can write in the about the sexual violence. Then type of violence, whether it is a physical violence, emotional violence, along with the sexual violence, if it is there, any history of drug or alcohol intoxication. Okay, if survivor has left any mark of injury unaccused, usually the bite mark. Okay, there can be some bite mark, there can be lacerations, or there can be bruises, scratch abrasions. All this you can write it in the this column, right? Then details regarding sexual violence like penetration, ejaculation, oral sex, or masturbation, history of masturbation, talent, that is, or forced manipulation of assault genitals by survivor. So all this, exhibitionism, use of condom. So all this you can write yes or no or don't know, like that you can mention in the history related to sexual violence. So the rape is a heinous crime. Rape is a legal term, not a medical term. So the rape decided whether it has happened, not happened, decided, judged by magistrate, not by the doctor, not by the. Our duty is to give evidence, trace evidence to help the whatever that is complaint that is given, right? So all this you can write again. Exhibitionism. That well, the question can be asked: what is exhibition? What are types of exhibition? Like mooning, flashing, all this. So all this are important components of component 5. Next comes is the examination. With examination, the first thing is gender physics exam. You need to measure pulse, BP, temperature, respiratory rate, pupils. So if any injuries on the body, very important. Injuries can be very important evidence, like abrasions, lacerations, scratch mark, bite mark. If it is there, that you can mention in the this. Then local examination. A very important component is the local examination. You need to examine external genitalia. Any any finding that you can mention there. Mons pubis, glands, shaft of the penis, scrotum testis, urethral meatus vestibule. If any bleeding, any discharge, any edema. If female, then you can examine labia majora, labia minora, porcata, introitus, hymen, perineum. If accused a third gender, then you can examine clitoris and labius scrotum. If any finding that you can write, if you know finding, you can write not applicable. And you can write. Then anus and rectum, like bleeding, tear, discharge, edema, tenderness. If it is there, you can mention. Oral cavity, bleeding, tear, discharge, edema, tenderness. Anything that is there, you can write anything significant. And also examination, very important while giving potency certificate. Okay. So potency certificate is also component of this report. System examination and also psychological, usually in case of repeat offenders. Okay. Then investigation. What investigation basically? So general investigation, like example, blood for HIV, VDRL, that is syphilis, hepatitis B, sugar, hemoglobin A1C, urine for sugar and drug, ECG, and X-ray for injury, color Doppler of genitals. All these are general investigations. So, what are important? What is the important component? Collection and preservation of samples. This is very important. You need to collect the samples, so that will give an idea about whether there is a intercourse or not, whether there is a forced intercourse or not. So, what are the things? So, what are the samples to be? The first thing, that is the clothing, like example shirt, bunion, right? The innerwear of the accused, all were air dried. Remember, air dried. This can be asked and wrapped in a paper bag. The very important evidence to be collected. Then hair, especially the pubic hair, or any matted hair, also cut strand of pubic hair. All this should be out. Then swabs, basically from the mouth, scrotum, pubic area, inner aspect of thigh, and the penis. Penis, especially from the shaft, coronal sulcus, and urethral orifice. 3 swabs can be taken from the penis. So the first one is the cloth, and the second one, that is the hair, and third one, that is the swab from the genital area and also from the mouth. Then penile washing, look for any vaginal epithelial cells present over it. Nail scrapings, so there can be, very important in or the debris related to the victim. So that can idea about intercourse or as well as sexual violence. Then filter paper used for wiping the shaft of the penis for legal side. So the question can be asked, very commonly asked, what is the importance of toluidine blue? Both are very important questions. So legal iodine that detects vaginal epithelial cells. So if vaginal epithelial cells are there, because they contain high amount of glycogen, so they react with the legal iodine. So that will give you the color of brown color, right? So this can be asked in an exam. Next comes is the blood for the grouping, blood grouping, and also for the DNA card test. DNA, that is the card test, check the accused. So this is about the very important sample collection in case of accused examination. Next comes is the uh, right provisional medical opinion. In the beginning, you can give provisional medical opinion. Okay. I have examined the accused or the offender, male or female, aged, and reporting dash days or dash hours after the alleged incident, after having bath or ETC like that. So my findings are as follows. So you can write sample collected for FSM, sample collected for hospital laboratory, you can write clinical finding, additional observation. You can write clearly the opinion is kept pending, awaiting the above laboratory. So this is provisional medical opinion. So once you receive the reports from FSL and clinical, then you can give final opinion. In between, you can give treatment also, like wound treatment, tetanus prophylaxis, hepatitis B vaccination, and also post-exposure prophylaxis for HIV if needed. All these are treatment aspects, and the copy of treatment prescription has to be given to the accused. Next is the final opinion. Final opinion. See, final opinion in being a UG student, if you know few aspects, that is more than sufficient. Okay. So the provisional opinion, that final opinion can be like this. There are signs suggestive of recent sexual intercourse. There are signs suggestive of recent sexual intercourse. Or there are no signs of recent sexual intercourse. As you know, intercourse can be either vaginal intercourse, anal intercourse, oral cavity or oral intercourse. So you need to give a report like this. It all based on the presence of vaginal epithelial cells. If vaginal epithelial cells are there, okay, are found, or vaginal fluid is positive, then it shows that there is a recent sexual intercourse. Then if anus vaginal epithelial are if anal epithelial cells are there, then it can be anal intercourse. If saliva is positive and the swabs taken from the shaft or gland spines, that shows that there is a oral intercourse. So this is the opinion one. Then there are signs or no signs suggestive of being under influence of drug or alcohol. Again, it based on the drug, alcohol, positive or negative. Then there are no signs suggestive of sexual intercourse. But remember, in case of fingering, use of object, other non-penetrative sexual act, so there won't be any signs suggestive of intercourse. Any other comments you can mention in the final opinion, like use of force in physical, if some injuries are there over the injuries are there over the acute, if any genital injuries are there. Okay, so if anything relevant that you can mention, then finally the date and place, signature, name of the examining doctor, skill of the examining doctor. So this is how you need to give final opinion. So the one opinion very commonly asked is the A, that is the opinion number one. There are signs or no signs suggestive of recent sex. Intercourse can be anything, that is vaginal intercourse, anal intercourse, oral intercourse. Again, it based on the presence of vaginal epithelial cells for the penis, or that is if anal epithelial cells are there over the penis, or the epithelial cells from the saliva which is there, then it is the oral intercourse. So this is how you should give final opinion. If you answer like this, that is more for passing your exam. Next is the potency certificate. So this is asked in your recent exam, asked in your NEET PG exam, and also in your INSET exam. How to give potency certificate? Remember, potency certificate is given in double negative form. Double negative. How that is? There is nothing to suggest that a person is incapable of performing sexual course. Double negative here. One is the nothing. The nothing to suggest that person is incapable of performing. Incapable. Double negative. So then, if all the findings are normal, but then you can write any all physical findings are normal, then usually we give report. There's nothing to suggest that a person is incapable of performing sexual intercourse. Nothing but double negative. Or sometime, if any relevant injury is there, or some disease is known to cause impotence, known to cause there are many causes, which can cause impotence. This is known to cause impotence. So if injuries, so then you can write the person is incapable of so, but remember, according to 375 IPC, so anything can be rape, even penetration, version, manipulation, application of mouth also can be rape. So, so the potency certificate, the value of potency decreasing day by day, because not only the penetration but also the insertion, foreign object, manipulation of both also keep according to section 75 or 63 BNS. So again, the signature and the name of the signature and the place and the, so this is how you should give potency certificate. And also the question can be asked: define rape, the punishment for rape, what are the extensions of 376. So what are the sections, what are the sections to act, what do you mean by PSA, APS, sexual assault, or ASA, something like that. The question can be asked: what do you mean by juvenile? What is the use of lugal iodine? What is the use of toluidine blue? And can be asked. So all these are frequently asked questions. Okay, so that's it about the one short exercise that can be asked in your FMT practicals. That is examination, accuse of rape. So that is medical examination comes under 53 ACRPC or 52 DNSS. So that's it about the topic. Thank you.